Now we're looking at a very important vein of the foot, and this is what is known as a lateral marginal vein of the foot. So lateral marginal vein of the foot, this is a lateral marginal vein of the foot, okay? So it's away from you and is on the margin, is on the boundary, okay? Lateral marginal vein of the foot. So the lateral marginal vein of the foot, you know that is a superficial vein. In fact, if you palpate the side of your foot, you should be able to touch it. So it runs along the lateral border of the dorsum of the foot, and it drains blood from the lateral side of the foot, and it continues upward to form the small saphenous vein. That's if we had, well, the snot is even labeled the small saphenous vein, that it goes up into your leg. Do you understand? So that's the lateral marginal vein of the foot. So let's quickly move. So what's the origin? It begins at the lateral side of dorsal venous arch of the foot. Okay, lateral marginal vein of the foot. Very good. Okay, so cause it runs along the lateral margin of the foot, passes behind the lateral malleolus, ascends along the posterior aspect of the leg, where it will now contribute to form what? The small saphenous vein. This is what? Lesser saphenous vein is still the small saphenous vein. Okay, it's still the same thing. So tributaries, it receives blood from the dorsal venous arch of the foot, small superficial vein from the lateral dorsum and the sole. So drainage, it drains the lateral dorsum of the foot, also drains parts of the lateral sole, and ultimately empties into the popliteal vein via the small saphenous vein. Okay, so beautiful. So relations, it lies close to the lateral malleolus and the peroneal tendons, communicates with the medial marginal vein through the dorsal venous arch. It's important in the venous return from the lateral foot and the leg, can be involved in varicosis injuries, and also venous insufficiency. Also serves as a landmark if you want to do some saphenous venous grafting and venous access. So it's sometimes referred to as the vein of Seville or Klippel Trenaunay, okay, in clinical literature, okay, because those are disease conditions and this vein is usually affected.